to take a whole series of actions to make more vaccines more available to underserved communities. In early January, we launched the Maryland Vaccine Equity Task Force, led by General Burkhead, along with the Lieutenant Governor and the Maryland Department of Health's Office of Minority Health and Disparities. We called on each local jurisdiction to appoint an equity task force advisor to work with General Burkhead and her team and to develop their individual plans for equitable access to vaccines in their local communities. We deployed the very first National Guard emergency vaccination support teams to Prince George's and Charles counties and assigned hundreds of Maryland Responds Medical Reserve Corps to immediately expand the capacity of their county vaccination clinics. Over a month ago, at an event in Baltimore City, I launched a $1.5 million statewide vaccine confidence campaign, which features PSAs from trusted ambassadors, including the Lieutenant Governor, UMBC President Freeman Hrabowski, Coppin State men's basketball coach Juan Dixon, and Prince George's County Executive Angela Alsobrooks, along with many ministers, community leaders, and many others. The plan calls for adding even more ambassadors over the coming weeks to continue this public information effort to promote vaccine confidence. The GoVax campaign includes TV, radio, print, and social media buys, all of which we will be increasing and expanding in the coming weeks, along with a series of virtual town halls and a whole range of marketing partnerships with numerous churches, nonprofits, and associations. To close the digital divide, we established a COVID-19 vaccination call center to make vaccine appointments and information easily available for Marylanders without internet access, with live agents available in both English and Spanish 7 days a week. And we're about to launch a pre-registration system accessible for residents with and without internet access. We placed all 4 of the state's first mass vaccination sites in majority-minority jurisdictions, including Prince George's County, Charles County, and 2 in Baltimore City. With M&T Bank Stadium now operational, we have transitioned the Baltimore Convention Center to focus exclusively on underserved populations in Baltimore City. And we are proactively reaching out to eligible individuals who live in high vulnerability zip codes to register them for vaccinations. The Biden administration's plan for ensuring equity in vaccine distribution calls for utilizing federally qualified health centers, which serve patients who live well below the federal poverty line. Every week, state health officials allocate vaccines directly to community health centers to ensure equitable access. Vaccine distribution is all-inclusive and takes into account providers that focus on vaccinating vulnerable populations. Half of the direct allocations that go to Giant, Walmart, and Safeway are set aside specifically for reaching vulnerable populations. For example, Walmart is holding closed clinics for residents from Prince George's County's pre-registration list, and Giant is currently holding clinics at senior housing projects and at the Arc of Prince George's to reach individuals with intellectual and developmental disabilities. We're conducting direct text-based outreach to Prince George's County residents to proactively book hundreds of priority appointments each week at the Six Flags America vaccination site. We have worked with the Baltimore City Health Department at their request to make more than 30 transfers of their city health department doses to hospital systems to focus on vaccinating vulnerable communities. And as General Burkhead will discuss in more detail, we have recruited hospitals, clinical partners, and pharmacies to stand up dedicated pop-up clinics in vulnerable communities and at houses of worship. Today, to build on all of the months of comprehensive effort, we are announcing the very first vaccine equity operations plan of any state in America to further address health disparities, and the issue of equity, and to get more vaccines to people in every community who need them most. As of today, state of Maryland is on the verge of 1.5 million vaccinations. Our vaccination rate is better than 34 other states. Our percentage of population vaccinated is better than 29 other states. But just as importantly as making sure that shots go into arms quickly is that we work each and every day to ensure fairness and equitable access to vaccines. Before I turn it over to General Burkhead to present this plan, I want to express my profound gratitude to her for taking on this assignment. This is something I actually asked her to do back in the first week in January while she was commanding 15,000 troops from all across the country who were defending our nation's capital. And she immediately and readily accepted this next mission. And she and her team have been working tirelessly with health officials, with local leaders, and with other partners and stakeholders, and we're very grateful for her leadership. General?
Good afternoon. Thank you, Governor Hogan, Lieutenant Governor Rutherford. Thank you. Glad to be with you this afternoon. The Vaccine Equity Task Force is partnering with a wide range of public and private entities who all share the same goal, and that's putting vaccine into Marylanders. Historic data shows that vulnerable, underserved, and hard-to-reach communities face both structural and informational barriers to vaccine access. Growing disparities in these communities make it necessary to be intentional and concrete in steps that we're going to take to remove these barriers and improve the rate of vaccine in arms in vulnerable populations. What you need to know is that we are committed to ensuring access to the vaccine by reaching out to the community, faith-based organizations, and intentionality is our mantra. We want to meet people where they are. I was asked to review a letter from a constituent from Prince George's County. I'll call her Irene for this. Irene was writing to comment on the pressing matter affecting the health and well-being of people in her community. Her concern was access to the COVID-19 vaccine. She remarked about how her neighbors and the tremendous loss of life in the state and the surrounding jurisdictions has impacted her and her community. She noted the disproportionate number of minorities and essential workers affected by the COVID-19 pandemic. She went on to cite several numbers from the Maryland State Health Department website. Finally, she urged several steps to stop the virus in the community. I found this letter compelling and reassuring as Irene laid out several action items the Equity Task Force had already called for in their plan. What I will lay out for you today is an action plan. It is tactical, it is intentional, and it meets people where they are. So let's proceed. Process. From the beginning and at the core, this is a partner-focused effort with community-based solutions. The process is a collaborative effort with federal, state, government, Maryland Department of Health, local health departments, community organizations, both public and private organizations. Step one, thus far we have connected with a variety of community organizations referred to us from various sources. As we mature, our process will act as a clearinghouse from proposals we receive from the communities of interest to have COVID-19 vaccine clinics. Let me note, here we will demonstrate our cultural competency by assisting anyone with the forms that we have to fill out, and they are brief. As proposals come in from the community, the Vaccine Equity Task Force support staff will conduct an initial review for supportability, assessing each with multiple criteria. The review will take into consideration, at a minimum, the disparities in vaccine distribution in that location, capabilities and capacities of the community as outlined in their proposal, capabilities and capacities of the suggested public partners. Step three, a site assessment. In this step, the task force will consult with local health departments and other partners as appropriate and visit the site to complete an assessment. Step 4, support plan is developed. All information will be consolidated by the task force and a plan will be developed for review. Here's where we take into consideration the registration process. The state has worked to develop a few processes which allow the Vaccine Equity Task Force to be flexible in overcoming the barrier of technology. It is not a one-size-fits-all, and that is why the assessment is so important. Again, meeting people where they are and addressing the needs of the community and in the field in a very specific way. Step 5, I will consider all staff recommendations and balance them with other pending requests and active programs. We will also facilitate discussion on vaccine allocation to ensure task force consensus and that it is documented. And subsequently, we will forward that allocation for consideration. Step 6, we will submit the proposal to the Department of Health for review, and then finally the actual allocation of the vaccine. Step 7, on site, the vaccine support team will go into action. The task force will coordinate with all partners to schedule, provide oversight on the day of the event, and to be available to assist as needed. The system allows us as a task force to bring actual resources to assist in problem solving at the rollout and at the specific location. The goal is to provide enough support and oversight to make the clinic self-sufficient with minimal or no oversight going forward. New Shiloh Baptist Church, here is an example of the end product. After following the steps, the community was able to hold their first clinic with a soft launch of 50 vaccines on its first day. Also, here is an example of the private-public partnership. Safeway agreed to provide the vaccinators and the vaccine. Now that the community is comfortable with the process and setup, on 6 March, we will be back in Baltimore at New Shiloh Baptist Church for a second clinic. As I mentioned, the importance of the Maryland Department of Health, the Vaccine Equity Task Force, and the Baltimore Department of Health, we are looking to expand this successful initiative located right in the right place in the right community at the right time. Method. The plan that is being released today is flexible, it's data-driven, and reliant on a team approach to get Marylanders vaccinated. How will we get projects like New Shiloh into other locations? Here is an overview of the process by which we identify and bridge the gaps that are limiting the number of Marylanders receiving the COVID-19 vaccine. We utilize several validated social economic variables to identify the communities and the individuals who are vulnerable, underserved, hesitant, or difficult to reach. This composite will guide the outreach. A few specifics key to the Maryland Vaccine Equity Task Force composite includes an opportunity for updates frequently, the ability to adjust variables and weighing as over time to optimize equitable allocation. It includes the COVID cases. It adds vaccine data based on gender, race, ethnicity, zip code, census tract data, and the type of dose, first or second. And it avoids duplication of variables which could skew results. The Maryland Vaccine Equity Task Force composite variables specifically include population over 65, population with an annual income below $49,000, unemployment rate, population older than 25 years of age without a high school diploma, minority composition of the community, single parent households, households with more than one person in a room, households without access to vehicles, total COVID cases, and the amount of population receiving at least the first dose. Our sources for data include the 2020 census, the American Community Survey, the ACS, the Maryland internal data, CRISP, IMAP, the CDC Social Vulnerability Index, ESRI, and the Area Deprivation Index. Working with Maryland Department of Health, Ernst & Young, Dr. Ken Bellion with Jensen and Partners, and the task force, these data are compiled and analyzed to produce a Maryland-specific assessment. These assessments will allow the task force to focus on these areas to establish partnerships with local health departments and community organizations and private partners. and coordinate to ensure that we are meeting their shortfalls. Sacred Heart, and just over the last 2 weeks, we have been able to evaluate and stand up community vaccine sites. We will continue to work with community leaders to find what approach works best, as they know best what works in their community. We have listened and we will assist. While this one instance reflects our accomplishment, we still have a way to go. Sacred Heart primarily services a Hispanic Latinx community. We administered 150 vaccines on that day in coordination with Johns Hopkins as partners and the task force. We intend to continue at this location as well, and we will hope to have increased volume over time. The task force is working hard to ensure we meet the community leaders, groups, health department, and citizens. All 24 counties and their liaisons. The Equity Task Force is out every day connecting with the community and understanding the needs to bring shots to you in the community. The bottom line is that our efforts are transparent and will achieve what the governor has asked me to do, which is to break down barriers to expand access of the COVID-19 vaccine and to save lives of underserved, vulnerable, and hard-to-reach communities. I appreciate the support of the governor and the Maryland Department of Health as we work towards a more equitable distribution of vaccine plan. We look forward to upcoming events at the Prince George's County and the First Baptist Church of Glen Arden. We will add a site, once scaled, will provide over 900 doses a day to Prince George's County residents. The site will launch in March in partnership with the University of Maryland Medical System and the Maryland Department of Health. We will also launch Mobile Vax on the Eastern Shore and in Western Maryland. We are also looking forward to upcoming site visits to include La Clinica, Casa de Maryland, the Muslim Community Center in Montgomery County, to name a few. To community leaders, if you recognize a need, please reach out to your local health department. You can also find additional information on our portal, which will launch today. There is a correlation between knowing someone who has been vaccinated and wanting the vaccine. Among people who say they want the vaccine as soon as possible, 52% know someone who have had the vaccine. When you get vaccinated, be that trusted voice in your community and encourage others. Together, we will reach community immunity. If you need more information or to schedule an appointment, 1-855-MD-GO-VAX. Equality matters. Thank you.
Well, good afternoon, everyone. Thank you, Governor. Thank you, General. As you know, the objective is to get as many people vaccinated as possible so that we can end the coronavirus pandemic. When it comes to making major decisions, people often go to their friends, their family members, and experts for advice. And making the decision to get a vaccine, to get vaccinated, is no different amongst Marylanders or anyone else. You know, engaging with the pillars of our community across the state, including our faith-based communities, is a cornerstone of our strategy to allow us to reach those vulnerable, to make sure that they don't contract the disease and possibly succumb to coronavirus. And we want to make sure we address the equitable distribution of the vaccines. General Burkhead had mentioned that she and I have been visiting over the last several weeks several of our community vaccination sites. These community clinics are made possible by a partnership between the state, houses of worship, and local hospitals and pharmacies, with the goal of meeting people where they are in an effort to reach them in ways that government often isn't able to do. Reed Temple AME Church in Prince George's County partnered with Doctors Community Medical Center to bridge the gap for members of their community. During the visit, Pastor Mark Whitlock spoke openly about losing his mother to COVID-19 while he was looking actually at the pew where his mother used to sit on Sunday mornings. The pastor has been leading by example by encouraging his membership to get vaccinated and getting vaccinated himself. The chair of the church's health ministry shared her family's experience with the Tuskegee experiment and the fear that she and her loved ones had to overcome to get vaccinated to protect themselves and the people that they care for. During the first weekend, the clinic at Reed Temple was able to deliver 250 initial doses. Last weekend, that number climbed to 1,400 vaccines. Kingdom Fellowship in Silver Spring, which serves parts of Montgomery County and Prince George's County, has partnered with Holy Cross Hospital for a vaccination pilot. And in their first weekend, they administered over 100 doses, and the church has expressed a desire to continue that momentum. In fact, the Pastor Watley, took part, or is taking part, I should say, in a vaccine trial as we speak. And in Baltimore City, as was mentioned, Sacred Heart of Jesus Church, which serves a large Latino population in the Highlandtown area, had a clinic just, I guess it was a week ago. These days go by so quickly. And there was a woman that we met there, her name was Maria, who told us in Spanish that she was excited to get the vaccine that day and took pictures with us so that she could send back to her family in Peru. And she said that back home, many of the people don't trust the vaccine, that they believe it's dangerous. And she wanted to make sure that the pictures that she took would go back to her family and friends in Peru to show that the shots were safe and they were effective. She told me that she was grateful for the opportunity to get that vaccine, to get vaccinated at the church. And we are grateful for Marie and the folks like her who are using their voice to bring others along and move closer to ending the pandemic. As General Burkhead said, New Shiloh Baptist Church in West Baltimore is adding a vaccine clinic along with the myriad of resources that they provide to their community. And as was mentioned, is a partnership between the state and Safeway as well as the church. And they had a successful launch, a soft launch last week where they vaccinated approximately 50 people and are expecting to vaccinate 250 more this weekend of seniors from their community. So going forward, you know, these houses of worship, as we all know, are places of refuge. People feel safe and cared for there. And it's these community-centered models that will build confidence in vaccines and the vaccination process and provide more points of access for the COVID-19 vaccine as that supply increases and the number of people eligible for the vaccines increase as well. We look forward to further developing and expanding these partnerships to meet people where they are and to build the trust, and of course to get shots in as many Marylanders as possible. Thank you very much.
With that, we'd be happy to take a few questions. Brad?
Governor, thank you. So, I just attended a press conference with the county executive also Brooks. And one of the things she asked for was for a day or two to be set aside at Six Flags just for Prince George's County residents. Given these numbers that we now know that they've gotten a tiny percentage of the slots there over time. What do you think about that? Has it worked out with Prince George's at Six Flags the way it was anticipated? Can there be more adjustment there?
Well, I would say that we're willing to continue to work with the county executive and tweak the plans as we can. We're in ongoing discussions. Our team's had multiple discussions with her today. We talk just about every single day. The general just mentioned, I think, about the new announcement about a new clinic in Glen Arden that'll do 900 per day. We are reserving a certain percentage of slots at Six Flags every day, and with the increasing supply of doses, perhaps we can make adjustments. I'll say this, I want to give a shout out to the health department in Prince George's County, who's made some dramatic improvements over the past week or two, and I think they're doing a much better job, and their numbers are rising. I think we did 3,600 at Six Flags yesterday, and I think their health department location has also seen a dramatic improvement, and we're going to continue to work with them.
Governor, it sounds like from the rollout of this plan that a lot of this is community based. So the community will reach out to the state and seek to have these clinics in their communities. With the data points that the state has on hand, why is the state not identifying communities of need and then going in and actively identifying partners and reversing the process rather than making community churches and other groups reach out to the state?
Yeah, we're actually doing both, which is what I said in my opening remarks. It's why we set up the first 4 mass vac sites. We've set up partnerships with all of those hospital partners and pharmacies and other providers in those areas, and it's why we've reached out to try to help with the National Guard and others with some of the local health departments and others who are in the community. But we also want to reach into those smaller pockets where we're as the General's plan is attempting to do, because it's a top-down and a bottom-up approach. We're trying to do everything we possibly can. Currently, as of today, I think 60.4% of the vaccines are for white residents. Our population is 58.5, so that's slightly more than the population. But we're not where we need to be with the black community or the Hispanic community, and so we're continuing to take every effort to ramp that up. We're, I think, 3.5 times the national average, but not good enough, and we're going to keep working. I'm sorry. Oh yeah, well, we'll let the General address that.
Thank you. So, and I do want just very quickly hit on your comment about community-driven. It's community-driven because it's specific to a community. The needs may be different, whether it's what the barrier is. So that's why we're heavily involved in going to the community. But to your point, about community-driven. It's community-driven because it's specific to a community. The needs may be different, whether it's what the barrier is. So that's why we're heavily involved in going to the community. But to your point, of course, the data that I laid out, and that will drive us to certain locations. And with those locations, then the equity task force is reaching out and going into the community to ensure that we have the right partners. So we're hitting it from both angles, and the data drives us to do that. And then, so it has to be both ways, and it is both ways. And to your question, mobile vacs on the Eastern Shore, we recently, just this week, had conversations with Worcester, Wacomico, Dorchester, and Somerset counties with health departments to discuss getting the mobile vacs down. So there are 2 parts to mobile vacs. We have an actual bus that we'll put on the shore. Actually, in Dorchester County, they're actually doing a pretty good job with their mobile vacs that they have, and we're going to supplement that with our mobile vaccine. The vaccine trailer will actually bring vaccine with it to that location, and we plan to run that up and down the shore, depending on where the needs are. We also will be working with FEMA to bring in the FEMA trailers, which are larger mobile vacs, which will go and park somewhere for a couple of days. And we're looking at using those on the shore and in the Western Maryland area, particularly looking out towards the west. So we will do that.
General Hogan, I have a question about just some kind of hard numbers. Your plan, what do you envision the timeline being from step 1 to step 7? And when this is in full effect, what percentage of daily dose administration do you hope will be given through these community hubs as opposed to the other providers? Do you see shifting resources?
Right. So the first part of your question is really situation specific. And again, I go back to being in the community and understanding what the capabilities and the gaps are in the community. So in some instances, we've been able to move from one to the end very quickly because we can partner with a Safeway in the community or a Walmart, and we have people who are ready to come to the church and open it up, or to the venue and open, we're good to go. In other instances, it's taking some time to to walk through the process. How do we get your list? How do we get people in? So it's really situation specific. And we are very intentional about working with the community, not to stress anyone, to rush them through the process if they're not capable or wanting to move that quickly. Your other piece about hope, my hope is that we get more vaccine, and then I can be 100% like next week. So that's my hope, since you asked hope. And so that's the way I'll answer that.
Well, I guess there has been a call from leaders of Baltimore City and Prince George's County to rethink how vaccine is allocated and send more to places where there are more deaths, and to rethink adding racial and race and ethnicity to comorbidity. So I'm wondering, if you stand up clinics in community hubs this way, would that be a redistribution, or is this just more vaccine coming from another place?
So we don't, as I said, we're not getting any more vaccine. As we get more vaccine, certainly we'll be able to go to more places. But the vaccine is what we have. So as far as knowing that those communities are there and we need more vaccine in there, that's why the task force is so important, so that we can take that and elevate those issues. It's not just about, like, well, the number generally shows this. No, the number shows this specifically here, and I can't wait for you to stand up a mass vac site. But what I can do is we can get together with partners and go and address that immediately, a lot more quicker than any mass vac site takes to stand up, and that takes quite a while. So we can do this, and a mass vac site takes weeks.
Thank you.
Yes.
Thank you.
Hi. Some leaders in Prince George's and Baltimore City, I'm sure you've heard, have bristled at the way you kind of described the essence of this problem. And times that you emphasize hesitancy as the key obstacle when they feel like the distribution system naturally disadvantages people without time or technology or transportation. Can you respond to the criticism that dismissing the low vaccination rate with hesitancy is overlooking kind of some systemic problems that we're clearly addressing, but the way you've spoken about it, can you kind of clarify what you mean?
I use the exact same words that President Biden used and that the leaders of the federal government use almost every day. It's the same thing we announced at a press conference in Baltimore when we launched the vaccine confidence campaign. So, look, I'm not going to respond to every political criticism. We're just going to continue to do the best we can. We just said today that we're adding more people to our vaccine confidence campaign. We're going to spend more money to expand that. That's about developing more confidence. We heard Lieutenant Governor talk about we're recruiting ministers who are telling their story to encourage more people to want to get the vaccine. And the general, very movingly told the story about her own mother, who she had to convince to take the vaccine when we launched our effort more than a month ago in Baltimore. So, we're going to get criticism every day. A lot of people are very frustrated that there aren't enough vaccines. I'm sensitive to that. I'm frustrated also. But I'm not going to respond to every criticism by every person that doesn't like what we did or said.
Governor, was there a point at some point in regards to Baltimore City that either you picked up the phone and called the mayor about this, or the mayor picked up the phone and called you? Has it just been your staffs talking about how they get more vaccine or where the numbers are? There seems to be a lot of, for lack of a better phrase, fuzzy math about how these numbers have come up. A lot of people are confused because they think more vaccine is going to the hospital system and not enough to the street.
This is probably going to be taken out of context, so I don't want to be criticizing the mayor in any way, but we have conversations every day with his health department, which we're really cooperating with. I mentioned earlier, at their request, we've transferred 30 times doses away from the health department out to other providers because they weren't utilizing them, and we thought other providers could get them into the community. The mayor apparently was not aware of that. He kept saying that they weren't getting enough, and the health department kept saying, we have way too much, please send them somewhere else to help us. But they were doing a good job working with us, just the mayor wasn't up to speed. We also tried to send $9 million to the city to try to help them with their vaccine equity effort, which they turned down. We're still trying to get them to take the effort. So again, I'm not going to get into the political back and forth. I know the mayor is frustrated and receiving a lot of criticism. He tries to point the finger and blame it on us, but we're doing everything we can every single day to provide more assistance, and he needs to talk to his health department.
Thank you. Question for the gentleman.
Oh, yeah, General. She's got all the good answers.
I'm trying, sir.
Councilman also was mentioned about First Baptist Church in Month 15. Can you tell how, if you give them maybe a summary of what that would look like for residents to come through when everything gets set up?
Yeah, so when the assessment and all that's already done, and we have a schematic of how I think it's like a 63,000 square foot recreation center that we're using, right? So we have that all laid out, how the citizens would come in and how they would register, move out to get your vaccine after you've asked a few questions, and then there's a process, and then you have to go to an area and wait 15 or 30 minutes, depending on how long you need to wait to be observed before you can leave. So it's very efficient. We'll have the technology there for you to complete any paperwork online, and then it will be uploaded into the system that you're tracked that you've got your first dose.
Just a quick follow-up. Will there, let's say this is from Journal 5, will residents not leave before a second appointment is scheduled?
Correct. They will know. Yes. You schedule with your second appointment when you leave.
I have a question perhaps for the governor and also General Burkett. At a joint hearing last night with Baltimore City and Prince George's County, one of the participants called for, quote, a non-military/law enforcement leadership of the state's COVID-19 equity task force, in particular in the state's black and brown communities where we have not had a favorable and helpful relationship with those entities. How do you respond to that?
God, well, the National Guard, having commanded the Army National Guard for 3 years, I can't tell you the phenomenal job that our soldiers have done in the community. We're there in snowstorms. We're there in Ellicott City. We're there when there's discord. We are there to respond to the discord in Washington, D.C. We are there, COVID-1, when there were food banks that needed to be manned, when kids needed their laptops for school. The National Guard was there in their communities. So it's not for lack of trying or lack of being in the community and doing what the National Guard does best, supporting our homeland. So we will continue to do the best that we can and provide to the citizens of Maryland and to our nation. And I can't say any more that I'm so proud of my organization for doing what they do each and every day. You're welcome.
Last question.
Governor Hogan, can you go back to the Baltimore City talk on the letter was $1 million? Baltimore City says that they...
It's $9 million. Yeah.
$9 million, yes. They said that they wanted to go directly to the feds and bypass the state.
They have every right to do that. I was just pointing out that, the mayor says that the health department doesn't have enough, but the health department asked us 30 times to take some away and give them to other folks to help. And that was just a difference of opinion. And they're not getting enough help when they turn down $9 million. Thank you.
All right, you just heard from Governor Hogan, Lieutenant Governor, and General Burkhead on vaccine equity. Governor Hogan there responding to concerns expressed by Baltimore City Mayor Brandon Scott and Prince George's County Executive Angela Alsobrooks about equitable distribution of the vaccine. According to Maryland Health Department data, white Marylanders have received nearly 4 times as many vaccine shots as black residents. So to address some of the disparities, General Burkhead presented the Vaccine Equity Operations Plan, which is aimed at making sure Marylanders, specifically vulnerable populations, have access to the vaccine. Some of that plan included more outreach, overcoming technology barriers, partnering with public and private entities to expand vaccine doses, and utilizing different data sources to identify these populations and where to set up some of these clinics. We'll have much more information on this plan on WMAR-2 News at 5. Also, for the latest on the vaccine rollout, head to WMAR2news.com/vaccinatingMD. Thank you for joining us. I'm Mallory Sofaste. We'll send you back to regular programming.